Continued discussion of acute headache with venous sinus thrombosis. Headache with abrupt onset that lingers. Diffuse, but occasionally localized near vertex, in other words, the sagittal sinus, and central parietal areas, the transverse sinuses. Please make sure that you're familiar with the two sinuses that might be affected with venous sinus thrombosis. Allow the name to speak to you. Transverse and sagittal. Papilledema is going to be prominent, more common during pregnancy and immediate postpartum. Once again, when you think of thrombosis, you should be thinking estrogen, pregnancy, postpartum. Others, in terms of possible etiologies, hypercoagulable states, ENT infection also may predispose. In other words, look at the name. Topic is venous sinus thrombosis, resulting in acute headache. The name of the game is, what causes thrombosis in these sinuses? Sagittal sinus, transverse sinus. Diagnosis, MRI, imaging. Begin IV heparin, followed by oral anticoagulation. In other words, well, depending on the etiology, be careful though. If venous strokes occur, cerebral venography with local administration of fibrinolytics may be needed so that you can properly identify and manage your patient with venous sinus thrombosis. Here you'll notice that on your venogram, that on imaging, and you don't find any of your blood vessels that you normally should in this area. And that's what this picture is showing, specifically absent right transverse sinus. Why? Because of a thrombosis blocking the proper circulation. Summary of your venous sinus thrombosis, hypercoagulable states, pregnancy. For the most part, you're thinking about estrogen, and we talked about how local infection may occur as well, maybe after an ENT type of procedure. Preventive medicine, identify predisposition. Signs and symptoms, this is important here, bilateral dull headache, maybe perhaps a visual disturbance. Remember papilledema, because this is a venous sinus thrombosis. Differential in this female, perhaps pregnant lady, reproductive age, differential pseudotumor cerebri, migraine. Pseudotumor cerebri, you also find papilledema. However, on image with pseudo means what? False. So there's no tumor, no evidence of a tumor. Diagnostic workup, angiogram, MRI. Treatment, anticoagulation. Heparin, in a hospital setting, warfarin. In other words, anticoagulation.